It's time for Medical Moments with Covenant Healthcare, and today we're talking about colon cancer and what signs and symptoms you should look out for. We're here today with Surgeon Jorge Hernandez. Thank you so much for being here with us today.
Thank you for the opportunity to be here.
All right, so what are some of the common symptoms that people should maybe seek medical attention if they see in themselves?
Yes, colorectal cancer is one of the most common cancers. There are a lot of signs and symptoms that people typically are not aware of. They're very common, like changing your bowel habits. They can experience constipation, diarrhea, changing the caliber of the stools. They can be thinner, blood in the stools, weakness. All these symptoms shouldn't be ignored because, sometimes they go unnoticed by people that attribute them to other benign issues like hemorrhoids or more common problems.
So what population is at risk for colon cancer?
So pretty much everybody's at risk these days. There is a huge increase in the rate of colorectal cancer in younger patients, those patients under 50 years old of age, and they should be aware of these symptoms too. The majority of patients that we screen are over 50, but those patients under 50 are not being screened because our regimens start at 50 years of age.
So let's talk about colonoscopies. When do you think people should start getting them?
Colonoscopies are indicated for patients at average risk, starting at 50 years of age. Of course, if your family has a history of colon cancer, then you start earlier. Nowadays, some organizations in this country are recommending for average risk people to start at 45. Why? Because of the increased rate of colorectal cancer in younger patients. So then you should start at 45 if you're average risk. That's the message.
So what about stopping getting them? Do you have an age when you recommend people stop getting colonoscopies?
As we're living longer these days, and people are living into their 90s, even their hundreds, we need to not stop doing or getting the colonoscopies at a certain age, like we used to recommend in the past. In the past, if you were 80, we would say, okay, you don't need more colonoscopies, but that's no longer true. If you're 90 and you're healthy, you should get the screen, because if we find a problem, we can act on it. You're still healthy enough for us to recommend the surgery or other procedures.
People are living longer now. You got to make sure you stay healthy.
Correct.
All right. Well, thank you so much for being with us today.
Thank you. My pleasure.
Learned a lot. And if you would like any more information on today's topic, just stick around after the news at 9 is over. We'll be live on Facebook answering all of your questions.